to learn of a reason to be strong. Take my hand and we'll go to the
Hi! In today's video, I will going to discuss about the importance of conducting ultrasound on pregnant patients on their first trimester. This video will also cover some of the fetal abnormalities seen on the first trimester as well as their findings in ultrasound. So, without further ado, let's get into it. Before we jump into the main topic of this video, let us first have some short overview on what the fetal ultrasound really is. Fetal ultrasound is an imaging technique that uses sound waves in order to produce images of the fetus in uterus. Fetal ultrasound can help the doctors to evaluate the baby's growth and development as well as to monitor the patient's pregnancy. In some cases, fetal ultrasound can use to help evaluate possible problems or to help confirm a diagnosis. There are quite a lot of importance why ultrasound is being conducted on a pregnant patient on their first trimester. Some of these importance is to confirm the pregnancy and its location, determine the baby's gestational age, confirm the number of babies, evaluate the baby's growth, study the placenta and the amniotic fluid levels, identify birth defects, investigate complications, and to determine fetal position. Okay, we will now going to discuss some of the fetal abnormalities seen during the first trimester. On the list, we have the anencephaly. Anencephaly is a type of neurological disorder characterized by the absence of the vault of the skull and brain. This condition is the most common anomaly of the fetal central nervous system. For the ultrasound findings, no parenchymal tissue is seen above the orbits and calvarium. Some parts of the occipital bone in midbrain, however, may be present. Less than expected value for crown rump length or CRL. The crown rump length is the most reliable parameter for estimating gestational age up to the 11th week. Frog eye or Mickey Mouse appearance may be seen when seen in the coronal plane due to the absent cranial bone or absent brain and bulging orbits. So this is an example of the ultrasound image of the fetus with anencephaly, while this is an example of the ultrasound image of the normal fetus. As we can see on this first image, the head part of the fetus is not fully developed. Some portion of the head of the fetus is absent. So, since the head of the fetus is not fully developed, then this condition, the anencephaly, is most likely incompatible for life. That means to say that the fetus will most likely die. Next is the cephalocele. Cephalocele is a condition characterized by the outward herniation of the central nervous system contents or CNS contents through a defect in the cranium. For the ultrasound findings, a cyst protruding from the fetal calvarium representing a meningocele or cyst within cyst appearance, and a solid mass protruding from the calvarium representing a herniated brain. Again, this is an example of an ultrasound image of the fetus with cephalocele. As we can see on the image, there is an herniation protruding on the calvarium of the head on the fetus. Next is the megacystis. This type of fetal abnormality is characterized by an unusually large urinary bladder. For the ultrasound findings, presence of smooth and round anechoic on the abdominal part of the fetus, and the bladder longitudinal diameter is greater than 7 millimeter. So this is an example of the ultrasound image of the fetus with megacystis. So there is a presence of anechoic structure or part on the abdominal part of the fetus. This is the urinary bladder, and it mostly occupies the abdominal part. Next is the gastroschisis. This type of fetal abnormality is a birth defect on the abdominal wall where the fetus intestines is found outside of the body. For the ultrasound findings, there is a presence of hyperechoic structures on the fetus abdominal surface and loops of bowel floating in the amniotic fluid outside the abdominal wall. So this is an example of the ultrasound image with of the fetus with gastroschisis. As we can see on the image, there is a presence of hyperechoic structure on the anterior portion of the abdomen of the fetus. This is actually the loops of intestine. Next on our list is the cystic hygroma. Cystic hygroma is a disorder characterized by the presence of fluid-filled sac that results from a blockage in the lymphatic system. For the ultrasound findings, presence of thin-walled and serpiginous or multiseptated intradermal fluid collections, and extensive nuptial thickening extending along the entire length of the fetal back and in which septations are clearly visible. So this is an example of the ultrasound image of the fetus with cystic hygroma. As we can see on the ultrasound image, there is a presence of somewhat hypoechoic intradermal fluid collections on this part. The next on our list is the micrognathia. Micrognathia is a rare and subtle occurrence in which there is a small mandible that is abnormally positioned in relation to the maxilla. This fetal abnormality can also be associated on the retrognathia, in which the mandible is not on its normal position. So for the ultrasound findings, a very small or retracted mandible or and the lower mandible is not often seen on the ultrasound image. So this is an example of ultrasound image of the fetus with micrognathia. As we can see on the images, we cannot appreciate the lower mandible. The same on this picture, we cannot appreciate the lower mandible for the fact that either the mandible is very, very small or the mandible is positioned backwards. That is the retrognathia. And this case also illustrates the need of a careful observation of the fetal face during each obstetric ultrasound scan. Otherwise, serious conditions like this can go unnoticed and be diagnosed only after birth, when it might be too late to provide the necessary assistance and care. The last on our list is exencephaly. Exencephaly is a lethal congenital fetal brain development anomaly considered to be a precursor to anencephaly. It is characterized by calvarial absence and loss of fetal brain tissue to variable degrees. For the ultrasound findings, mass of dysmorphic tissue in association with absent ossification of the flat skull bones above the orbit, and the cranial vault is sometimes absent in most cases. So this is an example of the ultrasound image of the fetus with exencephaly. So those are some of the fetal abnormalities that can be detected by ultrasound during first trimester or less than 14 weeks of gestation. We can say that most of the fetal abnormalities are very dangerous in nature itself, especially the anencephaly one, because the survival rate of the fetus having those conditions are very close to 0%. Nevertheless, early detection and diagnosis of the condition is still very crucial so that a proper intervention and management can be implemented. Therefore, the prognosis will be improved and the survival rate of the fetus will increase. So that's the content of my video presentation. And I hope that you have learned something new. Be smart, be wise, you've been irradiated. Thank you.